Coronavirus cases in the U.S. are rising once again as we head into summer. The daily average number of cases is now more than 100,000. That's up drastically compared to the same time last year when the country was averaging around 20,000. The rise comes as the Omicron subvariant BA.2 is set to take over as the most prominent strain in the U.S. For more, I'd like to bring in now Dr. Celine Gounder. She is a senior fellow and editor-at-large for public health at Kaiser Health News. Dr. Gounder, good to have you back with us. So it seems that people are either feeling frustrated or nonchalant, hearing that cases are higher now, so significantly higher now than they were at this time last year. Tell us, why is this happening and how concerning it is for you?
Lana, there's really two factors that are driving these higher cases right now. One is the BA.2 more infectious subvariant of Omicron. The other factor, though, is that people have really gotten tired of all of the mitigation measures, in particular masking. And the fact is the masks work. And so when people stop wearing them, you do see an uptick in cases. We are concerned particularly for older people in parts of the country where there's less vaccination. We're concerned about more vulnerable communities, including immunocompromised people, communities of color, especially if they're in rural settings where the distance to your nearest hospital may be farther. And if you do have an uptick, those hospitals can be easily overwhelmed.
So, Dr. Gounder, as you say, people are tired of the mitigation efforts, but these numbers are going up. And some scientists are warning that our current vaccines and boosters may not protect as well against the new BA.4 and BA.5 Omicron subvariants. What does that mean for us? Are you concerned about spikes in death rates?
Well, this predicts a pretty rough fall and winter, rougher than we would have liked anyway. And the BA.4 and BA.5 variants that were first picked up in South Africa, they have been circulating at a low level here in the U.S., but we have enough data now to predict that BA.4 and 5 will outpace BA.2, will become the dominant variant sometime later this year, and immunity to the older Omicron subvariants, including the one circulating right now, really will not provide an immunity wall against BA.4 and 5. And the vaccines that are being designed—
Gounder, because that's a really important point, I want you to say that one more time.
Right. So the immunity wall that people have been talking about with Omicron, you're not going to have an immunity wall against BA.4 and 5. So prior infection is not going to protect you against BA.4 and 5. And we are in the midst of trying to update the current vaccines, but those are being updated for the current, not even the current, I should say, the very first Omicron variant. And so you're still going to have a mismatch between the vaccines and BA.4 and 5, which will likely be dominant later this summer or in the fall.
Because of that lag time. So it sounds like the best advice you have for people who are immunocompromised or concerned about this is to continue with those mitigation efforts that they have control over.
Look, keep up with your vaccinations. That still does provide a layer of protection, especially against the more severe consequences. But we're going to see breakthrough infections. And I would certainly advise continuing to wear a mask, especially if you're over the age of 50, really over the age of 65, and if you're immunocompromised.
Dr. Gounder, let's talk about monkeypox, because many people are concerned hearing about a new virus when we're still dealing with COVID. Are you concerned about monkeypox and its potential impact?
Look, we've got to keep an eye on monkeypox, but monkeypox is nothing like COVID. COVID virus can spread through the air at very long distances, and it's highly infectious. The monkeypox virus really requires close contact, very close contact, skin to skin or with respiratory secretions. And so it's not nearly as transmissible as infectious as the COVID virus. We also have ways of controlling monkeypox. We have vaccines stockpiled if they should be necessary. And monkeypox is unlikely to be very deadly, particularly where we have a very sophisticated healthcare system here in the U.S.
What lessons should we be taking away from the coronavirus pandemic when we're now starting to hear about the monkeypox outbreak?
I think there are two main lessons. So first of all, testing. If you go back and think to the spring of 2020 at the beginning of COVID, we didn't have enough tests. And this has actually been a challenge throughout the pandemic, not having enough testing available when people needed it or wanted it. With respect to monkeypox, a lot of that testing still has to be sent to the CDC or state labs. At the same time, hospitals, universities, commercial labs have the ability to do these PCR tests. It does not need to be done at such a specialized lab. So really decentralizing and increasing capacity is really important. Secondly, we should not be stigmatizing people who have monkeypox. And while this is not a gay disease, we do know that it is most actively spreading among men who have sex with men. So the time right now is we need to be educating, doing active outreach to men who have sex with men, including at places where they frequently congregate, whether that's saunas or gyms, clubs, and the like. We should be using apps that are used by gay men online. And we should not forget, as we saw with COVID, that marginalized communities, and particularly lower income and communities of color, tend to be left behind, tend to be ignored in these situations. And we really need to do active outreach to those groups as well.
All right. Dr. Celine Gounder, thank you for joining me, and thank you for all that you do.